So, welcome back, everyone. And we were just discussing here. I'm going to cut that out. So, again, Dr. Howard, you were talking about your transition with Jackie, and you said it was relatively easy. And maybe you could. I think it's good for the viewer to know that you guys were already pretty healthy already. I mean, you had, at least in terms of standard American diet. I don't think you guys were even eating standard American diet. I think you guys were a little healthier than that. But talk a little bit about what you were saying about just go to the produce department. So if somebody is thinking about doing this and they think, what am I going to be able to eat? There won't be anything left to eat. How do they address this?
Yeah, we often get asked, what am I going to eat for breakfast? Because the standard American breakfast is like eggs, bacon, cheese.
Right.
Rice. But often what I do when a person has heard this paradigm and has understood it and recognizes this is the way I want to live and eat, then one of the practical things you can do is just go to a grocery store. Oftentimes the first thing you walk in is the produce area. And for instance, we have a Whole Foods here. If we walk around the produce area, if I walk with somebody and I say, just tell me right now without making any changes, what do you love that's here? What is the produce? Vegetables, fruits. There's a dry goods area. I mean, there's bulk, beans, rice, things like that. Herbs and spices, which often make the difference about food tasting good. But you find what they like. Potatoes, all kinds of potatoes, sweet potatoes, white potatoes, little fingerling potatoes. So you find the things that they really like, and you say, okay, let's buy some of those. Let's take them home. Let's figure out how to fix them to eat them without ruining them. Because you can take a perfectly good potato, fried in deep fat, and put salt on it. You got French fries, which is potatoes are good, but fat and salt are not good. And to begin to build on what they already like. I mean, there's hardly a person that doesn't like something that's good for them. And to build on that and to build on that repertoire and make it more and more applicable in all that they do. And then you can take them through other parts of the store where you may need to read labels and stuff like that. But it's continued education in a paradigm, a transition of your culture from what you're used to, you learned, to a whole new way of living and eating and thinking and being able to read a label and see, is there too much salt, there's too much fat, there's too much junk in this thing. So that's the kind of thing that slowly people have to learn in order to begin to live healthy.
Well, I love that you're bringing this up because, as you know, one of my major interests is figuring out why, when we've had this information available with some doctors for more than 30 years, why is this not more well accepted? And you've kind of highlighted a few issues here. One is, with this client you had who you told her, there's two options. You can either do the classical medical route, which is to take medication, and basically you're going to be living with the disease the rest of your life, taking medication, which of course has side effects, and it doesn't really stop the problem.
Yeah.
Or you can do a dietary transition, a nutritional transition, a re-education, and change your life that way, and then actually get rid of the disease, address the cause.
Right.
And I hear a lot of doctors say this. In some ways, the doctors are just trying to give the clients what they want, and a lot of clients have a strong reluctance to change diet and nutrition. Have you seen that?
Well, part of it is we live in a culture. Many things, such as medicine, are almost more about money than about health. And I'm not saying that the doctors are conscious of that, but we have a system that has a way of treating people that doesn't fundamentally ask them to make any changes in their life. Okay, it's almost a passive thing. Person comes to me as a traditional doctor, they have a problem, I give them things, they take them, they don't really change their lifestyle at all. So to ask somebody to take lifestyle of which what you eat is the most central, most powerful part, and to take the things that you say you like the most. I mean, we have food companies that engineer highly addictive food, salt, sugar, fat, those kind of things, and people that are on those and have to some degree an addiction don't like to give those things up. But if they have a vision of health, a vision of a way to become a healthy, whole person, and they say, I want to do that, they often don't have a support structure that helps them along the way. They are surrounded by all kinds of things that are make it easier for them to eat junk and have a bad lifestyle. But to find a new way is difficult. But there are sources of information that can begin to. But typically, what happens is people feel isolated. They feel like nobody else around me agrees. They're asking me the protein. Where do you get your protein? Where are you going to get your calcium? All of which are questions that are easily answered, but they don't see this as a easy, natural way to health. The key being, when somebody begins to move in this direction, it often is so powerful and so quick. They begin to feel better. That is the hope, that once you tell somebody this, they begin to do it. They start feeling the benefits that it's reinforcing. The whole thing becomes self-motivating and reinforcing, that they want more and more because they feel so much better. That helps a lot.
Okay.
But it's often a battle that is very hard. But as you do it more and more, you get used to it. People begin to understand this is the way you live.
Right.
And they begin to see you blossoming, and they get interested and want to know, hey, what's your secret?
You know, I think one of the difficulties is that the human body is so adaptable,
right,
and that it can survive on many different diets.
Right.
It can survive. The question
Right.
is, can it survive optimally?
Right.
You know.
And, we're used to looking at a person and saying, well, this is what that person eats. That person looks healthy. This must be healthy food to eat. I mean, I happened to be looking up the oldest living person in the world was a woman, 117, I think, in Italy, and they were interviewing her, and they were saying, what's the secret to your health? Well, I eat 2 raw eggs a day. Well, okay, 2 raw eggs a day is not good, healthy food. She's 117. She's made it. But you equate what she ate to her health. You have to look at populations like the blue zones, which are the healthiest, the oldest living cultures in the world, the oldest living communities in the world that were healthy, and the 5 that they recognized, these are communities that eat 95% of what they eat is plant-based. Even when they have the option, the shepherds can eat their sheep. They don't. They sell them. They buy grain. Okinawa, they could get fish. But these are cultures where 95% of what they ate was plant-based. And the evidence is these 5 distinct cultures, not genetically the same at all, they all had that same theme. They ate almost, primarily plant-based, and that seems to be one of the keys to their longevity.
Okay. Now,
there is no culture in the world where people live to be old and healthy that has a high-fat diet. The rage is it's all in the fat, even good fats. There's no culture that has longevity and health that eats a high-fat diet.
Okay.
So,
now, how would you address these anomalies? Like you often hear these stories. My granddad was 95. He smoked a pack of cigarettes a day. So how do you address these anomalies? It's not the pack of cigarettes a day that kept him healthy.
Right.
It's probably that he was doing other things, perhaps a little bit genetics, although I think genetics are often way overemphasized.
Right.
How would you address the fact that this woman ate 2 raw eggs in the morning and she's 116? Why was she living so long?
Well, you can't make a decision that person equates to health on an individual basis because there's so many factors you don't know about. You have to take population studies, observational, experimental, to really find out what is the key of health. And so there's a lot of confusion about scientific studies in health, but there's not so much confusion that we're not clear about what's true. I mean, the clarity of nutritional research is the human being is really best fed and best nourished and best made healthy on a plant-based diet. Now, there are people that, the Eskimos, for instance, live in a part of the world where there's no plants. I mean, there's whale blubber, there's seal stuff, and they eat mostly that. And so there's been a while when, like for instance, the Weston Price Foundation would hold them up as the ideal of health. Well, if you actually really look at them, they can look healthy. Well, they die at a young age. They have the #1 incidence of colon cancer in the world. They have terrible atherosclerosis and osteoporosis if you really scientifically study them. So there's a place where you can have people holding them up as the paradigm of health until you actually start looking and finding out they're not healthy. So for instance, let me give you an example. Ischemic heart disease, the thing that causes heart attacks, the only thing that's ever been proven scientifically to actually not only just slow it down, but actually reverse it and undo the clogging of the arteries is a whole food plant-based diet. Proven numerous times. Dean Ornish is the one in 1990. July edition of Lancet is documented there, a scientific double-blind placebo-controlled study showing the reversal of heart disease. Nothing like that has ever been shown of any other way of treating ischemic heart disease. So you just take one thing and you say, okay, if this is the only thing that reverses ischemic heart disease, why is that not the diet for health for everybody?
Thank you.
By default.
Thank
and if
you.
And if you want to challenge that, bring forth some evidence and show scientifically that there's another challenger, the paleo diet or whatever.
Now, on that note, are there not? There's over 500,000 heart attacks or deaths from heart attack per year.
There's 800,000, I think, 800,000 a year in the United States die. It's number one cause of death. 1 in 3 people will come down with ischemic heart disease. It's now still the number. In fact, the numbers just came out recently. The life expectancy in the United States for the first time in a long time is actually shortened, like 3 months or so. And ischemic heart disease is actually on the rise in that last year, 2016, 2015 probably. But that's a surprise because now we're seeing the impact of our health culture, dishealth culture,
right,
in the fact that our longevity is now being shortened.
Well, this frustrates me, as my viewers will know. This frustrates me. This study done by Dean Ornish was when? 70s?
1990.
1990.
Yeah.
1990. So
and it's been proven other times. I mean, Nathan Pritikin,
right.
Walter Kempner,
right,
at Duke University, the rice diet was curing people with hypertension, diabetes, heart disease. Nathan Pritikin, who's an engineer, phenomenal researcher that started the Pritikin Health Center, was reversing heart disease with this diet. Dean Ornish, Caldwell Esselstyn, in his 30 years of experience, has proven that if you start the diet he recommends, which is a fairly strict whole food plant-based diet, he guarantees people within 3 weeks they will be heart attack proof. So you take people who've had multiple cardiac events. Maybe they've had, you take Bill Clinton. Bill Clinton, a smart man who, if I can recount his history, I think he had a bypass first, and I think he had a stent later on. And, he was known, pictures of him as a president jogging and stopping at the fast food place and getting his hamburger and fries.
Right.
Well, he was known for eating junk food. So, but he is then informed, you know what, you've had these 2 procedures, you're going to have another episode if you don't do something. So he finds Dean Ornish and Caldwell Esselstyn, and they basically said, you got to get on a plant-based diet, which he did. And if you watch him, he loses weight, he looks much healthier.
Yeah. And
he now is a proponent of this is the only way to treat heart disease.
Well,
it's fairly well known, but you can
unfortunately,
avoid it if you don't want to know it.
Unfortunately, I've heard that he has since begun eating meat again.
Well,
but yes.
Too,
But yes, I know that he had a tremendous transformation.
Yeah.
And this highlights the percentage of folks who get heart surgery because of atherosclerosis and then have to go back for procedures later on or die of it. You told me, what's the medical term, when you die instantly of a heart attack?
Sudden death. Term we use. People.
Yeah, so there are many.
Let me give you the statistics. A person with ischemic heart disease, there are a number of ways to treat it. If you eat the standard American diet, you eat all the stuff that everybody else eats, even if it's slightly towards the healthy end, the statistics are that 2/3 of those people will recur. They'll have some other event. Angina comes back, heart attack, sudden death, whatever. If you eat the Mediterranean diet, which is now the kind of the medical standard of how to treat it, many people say that's the best thing. There's a 25% recurrence, a whole lot. 66% recurrence, 25% recurrence. A whole food plant-based diet, documented by Dean Ornish Caldwell-Esselstyn, not only slows it down, it actually turns it around and cleans out the arteries. In other words, a person that has had 3 episodes, you can go to them and say, are you worried about having another one? Yeah, I'm worried about having another one. I'm tired of chest pain. I'm worried. Would you like to get to the point where you don't worry about it? In fact, you can be quite assured you'll never have another event. I mean, to share that with somebody, it's like, really? I could be so sure that I would never have another one? How do I do that? Well, this is very clear. It's very easy to document. It's hard to do, but once you do it and you benefit, you feel the reward of, I'm becoming a healthy person. I don't have to worry about heart disease in the future. I mean, to me, it's a no-brainer.
Exactly.
Why don't you just do it?
Now, I think one of the problems has been, although this is changing now, one of the problems has been that generally this SAD diet, it is a slow accumulation within this body such that these chronic illnesses don't appear until, say, your 40s or 50s. Now, I know there are kids now who are like type 2 diabetics in grade school, which is a new phenomenon and a separate category. It means that the nutrition has basically devolved to such a point that folks are getting diabetes now in their kids.
Yeah.
But generally speaking, say up until about 15 years ago, there was a slow progression of these illnesses, which manifest with strong symptoms in the mid-40s to 50s.
Right.
So people have the mistaken impression that they're having a relatively healthy diet until they actually get this disease. But the truth of the matter is it not, that these diseases have been slowly built up until the symptoms manifest.
Well, if you take ischemic heart disease, which we've been talking about, the atherosclerosis, which is the hardening of the arteries or the plaque in the arteries, the studies now clearly show that children in the uterus, if their mothers eat a standard American diet, they already have fatty streaks when they're born, autopsies of 5-year-olds. I mean, this started actually in Vietnam when 20-year-old men, autopsies, you've already got significant atherosclerosis. It may not manifest until they're 50, 60 years old with a heart attack or something like that, but we already know that they have the disease at an early age. It takes slow progression, but they're feeding it. They think they're fine. They're not fine. So a lot of these things.
And just before you continue, those Vietnamese soldiers did not have atherosclerosis because they were eating.
No, they did. No, they did have it back in the Vietnamese era.
The American soldiers did.
Yeah, the American soldiers.
The Vietnamese soldiers
I don't know about the Vietnamese
did not.
soldiers. No.
Because they were eating rice and vegetables and a little bit of meat.
Well, if you go to sub-Saharan Africa or rural China, rural India, where they eat a traditional diet that's primarily plant-based, those people literally do not have atherosclerosis.
Right.
Okay, they don't have heart. I mean, I practiced in Kenya for 2 years, and Dennis Burkett, who was in Uganda for 20 years, no heart attacks. They're not heart attacks there, unless they're rich people that eat a rich Western diet. That's what causes it.
So I guess kind of what I'm doing here is I'm trying to step through the reasons why the public has not broadly recognized these principles, which now seem so obvious to you and I. And some of the things we've touched on is that these chronic diseases are slow in terms of progression.
Right.
And then another is simply habit, culture, tradition.
Right.
And then you mentioned an interesting point, isolation. People can feel isolated because they don't have a support system to actually facilitate this transition.
Or they're in a support system where everybody's sick and it's the norm.
Right. Yeah, you were talking about this earlier. One of my heroes, Dr. Herbert Shelton, he had a term, pathogenic norm.
Yeah.
Pathogenic norm. And, if 90% of the population is overweight, you begin to think that it's normal to be overweight.
Yeah, right.
So this is why I think some of the results of applying these plant-based principles to people in terms of chronic illness, they're so striking in how rapidly people recover. It's mind-boggling.
Yeah. But one of the powerful forces that keeps people from adopting this way is the sense that we are um, um, the sense that you're having to deny yourself. Okay, we live in such a culture of affluence where food-wise, rich food is available all the time, and we get used to this norm of not only rich food but food that's engineered. Now, for instance, the food companies take salt, sugar, and fat. Incredible research, sugar. They find the bliss point, they call it, the perfect amount of sugar that just takes your taste buds and turns them on, just like cocaine turns your brain on. Same kind of neuropathology. But and what they do is they make this. You go into a 7-Eleven and you see all this stuff that's readily available, and it's so easy, quick sugar rush that you almost become addicted, and you live in a culture where rich food is so prevalent and available that the person who wants to be healthy can easily get the sense that, oh, I have to deny those things. I have to, live an austere life. Well, there is discipline that's required. The Olympic athlete will never make it unless they discipline themselves to be healthy. But the thing is, once you get past that initial kind of beginning of feeling like, oh, I have to deny myself, everything I want I can't have, and what you enter into is a whole new way of living where the things that you have learned to love and enjoy are readily available. You can enjoy them. You can have a wonderful, fulfilling life, and you don't feel denied anymore.
Yeah.
I mean, you have not arrived if you feel like you're being denied and you're not allowed to eat all the good stuff that everybody else can have. You'll never arrive that way.
Yeah.
Because you always feel like, oh, they have all the good stuff, I don't have it. But my wife and I have come to the point where if we go someplace and somebody offers us, some meat or cheese or something like that, there's nothing special about us. We're not extra disciplined people, but we've come to the point where we've experienced the reinforcing positive things so much that we're not interested in that kind of stuff anymore. We love the stuff that loves us back. We love the food that loves us back and makes us feel. It's not that we can't overdo it in one way or another. We may at times, but in general, you've arrived when you're very happy, you feel fulfilled, satisfied, and you don't feel like you've got to have something that you can't have.
Yeah.
So
now on this note, let me ask you, if you're at a restaurant, or even a better example would be, let's say friends invite you over for dinner. They don't know that you're plant-based, or perhaps they have some plant-based options, but maybe they're high in oil. To what degree do you resist eating these foods? Let's say you don't want to insult the host. There's some potatoes cooked in oil. There's no animal products, but it's kind of high fat. What would you do in that situation?
Well, the philosophy for eating at a restaurant or eating at a friend's house. Okay, there are situations in which they may sit you down to a spread that has some things, and it's not forbidden to socially do what's acceptable, not offend people. Okay, but you don't want to make that the norm. And there's some weak-willed people that let other people determine what they eat all the time, and it can ruin their health. But we try to tell people in advance, this is kind of our eating style. Oh, it's easy, don't worry. Fix whatever you want to fix for yourself. If you have a few vegetables, that's what we'll eat.
Yeah.
When we go to restaurants, we have a philosophy where it's interesting, some of the most obvious restaurants you could never go to and get what you want. I mean, now, French restaurants, it's all about cream and butter, so
right,
and cheese. But if you go to ethnic restaurants, Mexican or Italian or Chinese, usually use a lot of oil, and it's oftentimes very difficult to get them to cook you something good. They have a lot of good stuff, but they just cook it all in oil. But if you go to a Mexican restaurant, we were at a little Mexican restaurant the other day. We go in, nobody else there, so we say, and we look at the menu, it's all cheese and meat and all that stuff. So we say, now, you just have rice, don't you? Yeah, they only had white rice, it's fine. you have beans, don't you? Well, yeah, we refried beans. Well, refried beans, I don't want that. It has oil in it and stuff like that. But you have pinto beans. Yeah, we have pinto beans. So just bring us some rice, some pinto beans, and a little few vegetables on the side and a salad.
Maybe some salsa.
We ended up with an amazingly good meal for $10 for both of us, you know. But in an Italian restaurant, pasta's not unhealthy, but don't pile it with a bunch of meat. Marinara sauce,
Right.
some vegetables. There's actually a downtown grill that's known for big pieces of meat, and it's a place that, because we've had experience there, when we go there, they have huge vegetable sides. You order asparagus, you tell them how to cook it. They come with a big pile of asparagus for $9. It's like phenomenally good. It's one of our favorite places to eat.
All right.
You think you're a vegan, you go to the downtown grill? It's like a secret place to go. So.
All right. Let me
give you another one. The Wendy's. You go through town, little tiny town. There's a few fast food places. You go to Wendy's. You get a baked potato. Don't put anything on it except take the broccoli. They do broccoli and cheese, and they pour all this stuff on. You just say, I just want the baked potato. I want the broccoli, and then we'll get a little salad with balsamic vinaigrette dressing.
All right.
We put those together. I mean, we eat the salad. We maybe use some of the dressing on the potato, and that's a perfectly healthy meal at Wendy's.
That's great. That's a great example. So I'm going to kind of wrap this up so that we don't take this session too long. But can you tell us a little bit about some of the clients you've worked with? So at first, I think you kind of work with clients informally,
Right.
And now in the past year, you've started an actual more formal practice, Renovare. Can you describe for us what you've seen with some of the clients? Perhaps some of the difficulties you've had in sharing these principles and getting folks to embody them, and what are the results?
Okay. The best kind of patient, or the most prepared patient that we would love to see, and from experience we've kind of found out these are the most likely to really want to do this and succeed, are those who have had one of these chronic diseases. We'll use type 2 diabetes as an example. Who have suffered for a long time, have begun to have some of the side effects, some of the complications that really compromise their life. Those people that have gotten frustrated with the medical system, they've done everything they can. They've seen falling apart no matter. And what they do is they come to the point of saying, I'm sick and tired of having this problem. I want to do anything to get over this problem. They may go to their doctor and say, I'll do anything. Tell me what to do. And what frustrates them is their medical system can't tell them. Maybe they can't tell them simply, or they send them to a dietitian who says, well, do this and that. And it's really not adequate. So we take a patient and we say, because I'm a traditional doctor, okay, this is the way it's been done, and this is the understanding. Here's a new paradigm, and I want to tell you what this can do. This can completely reverse this thing. It's very powerful. A plant-based diet can sometimes reverse things. I mean, there's studies about diabetic neuropathies, which are either burning or numbness in the extremities, and there are actually studies, if you look at Michael Greger, where within 4 days you can begin to see improvement simply from changing the fuel you're putting in your body. 4 days, and some people begin to get some relief of that.
Yeah,
it's amazing. But some of the patients we've had are type 2 diabetics. It's actually not that hard as long as the people are willing to be strict and rigorous. We had a guy with terrible heart disease in his 60s who had not had any problem. Within a few months, these vague problems, ends up with bypass surgery, a heart attack after the bypass surgery, another procedure, all this stuff. He ends up on 16 medicines. He's going to the heart failure clinic. So he's referred to us, he and his wife, they come. We spend 2 or 3 hours just talking with them and saying, okay, here's what you need to do. We show them the direction to go. It's all about your lifestyle, which your diet is the main thing. And what you need to do is eat a whole food, plant-based diet. You know, good, nutritious foods, not spoiled, not a lot of oil, not a lot of salt. And because those people were kind of self-starters and self-learners, they could get all the resources we could give them, and they could figure it out and do it. They were so motivated. We saw them one time, Didn't see him for 3 or 4 months, and if we happened to be in a store where we saw him, I said, "Is that so and so?"
Because
Lost weight.
Yeah.
He said, I'm off half my medicines. I'm going to get off the rest. My heart function is markedly improved. And this is a man that all you had to do is show him the direction, and he found out. And what's interesting, he's now teaching cooking classes and things like that. That's one. We had a woman with multiple sclerosis, and multiple sclerosis is treated by neurologists she was on Avonex, which is interferon B, cost $55,000 a year, marginally helpful, lots of side effects. And the best treatment for multiple sclerosis is a low-fat diet, as documented by Dr. Roy Swank, who was the head of neurology in Oregon, treated people for 50 years. The neurologists say, well, he didn't do the right studies, and we don't think, well, you get somebody who's decompensating, headed for a wheelchair, headed for a bed, headed for death, and you got them on Avonex, why not try them on a low-fat diet? I mean, 95% cure or improvement is the results that he got. So we've had somebody like that.
Yeah. I've actually interviewed someone with MS,
yeah.
and she applied these principles, and she has largely recovered.
Right.
So
it's amazing.
Yeah.
We've had some patients that have, like Parkinson's, does not respond to fasting, to diet change. We found some other things. Marty Hins is a doctor that has really found some amino acid treatment that's really markedly helped. So there are some things that this does not help. Let me think.
Well, on that note, before you continue, let me ask you this. I think we talked about it before. If it's true, which evidence seems to bear out, that many of these chronic illnesses, which until recently have been characterized by traditional medicine as incurable, without heavy use of medication, and we find that by applying these low-fat, plant-based principles, you can reverse a lot of these chronic illnesses, and you can do so rapidly. Isn't it logical to assume, then, that this diet is beneficial for the body in terms of health in general? I mean, why does this diet work so effectively and so rapidly? Does that not speak to the fact that this diet is perhaps the most ideally biologically suited diet for the human species?
Well, you said at one point we are apparently omnivores because we can literally almost eat everything. You go to China and they do eat everything there. But
Yeah.
I mean, we can eat all kinds of stuff, and you see people walking around, they seem okay. That doesn't mean it's optimal. So if you look at the fact, you take the blue zones, for instance, where 5 uniquely distinct cultures in the world eat a 95% plant-based diet. They're living a long time, many of them into 100 years or more. They're living healthy, many of them without any dementia, without any heart disease, without any traditional chronic disease in the United States. And then you find out scientifically the whole food plant-based diet reverses ischemic heart disease. You begin to say, maybe that's what and you look, those who have taught about the anatomy of the human being, you look at the anatomy of our body, and in comparative anatomy, you look at the anatomy of a cat or a big cat or a dog or a chimpanzee, and you look anatomically, we are anatomically herbivores. We have the body, we have the teeth, we have the digestive tract of an herbivore, not a carnivore. And so this fits with this same thing. You have a lot of different directions of research that all point, for instance, the explosion of research in the gut biome, which is the bacteria in your intestines. More and more they study that, they find that the primary food that your gut bacteria like is fiber. Fiber. Where does fiber come from? It comes from plants. It doesn't come from animals. It doesn't come from refined stuff. So you take just that little line of argument, it points towards a whole food plant-based diet. You look at the anatomy, it points toward the blue zones. These all point exactly the same way. Direction, it's like, hey, wait a minute. This becomes, after a while, a no-brainer. I mean, this is, why isn't this? But the thing is, we can seem to get away And these theories about the paleo, the ketogenic diet, the Atkins diet, they're popularly, I mean, as John McDougall, people like good news about their bad habits. I mean, if some people say you could eat eggs and bacon and cheese and all the fat-rich stuff you want, I mean, there's lots of people love that message. You know, it makes lots of money, but it doesn't make for healthy people.
This is criminal to me. If you you can pull up Dr. Atkins' death, you can get there's a brief history of how he died and his health condition when he died. He was over 200 pounds. He had the classic symptoms of heart problems, but they wouldn't release the information. He didn't want to release the information because his whole empire, this Atkins empire, was based on this fallacious notion that you could get healthy by eating fat.
Right.
Now you might by eating animal products and what did they cut out? They recommended cutting out carbohydrates. They saw some very qualified improvements for people who did that if they had a horrific diet prior to undertaking that change. But that doesn't mean that's the ideal diet.
Right.
And I think Dr. Atkins is clear-cut evidence that it was not the ideal diet. And then all these modern variations that they're simply Atkins revisited. They have what are these, like sugar busters and what's the wheat belly guy and people. People are making a lot of money selling these books. They're basically refined expressions of Atkins, which is cut out carbohydrates, eat a lot of protein. Not only are there problems from these high fat intake, but high protein intake, and they're all related to these illnesses that we talked about. I mean, Campbell's work, the China study, right? Does it not clearly show that if you have high quantities of animal products in the diet, your percentage chance of cancer goes up significantly.
Yeah.
So,
and a study in the JAMA just this summer, August, I think it was, that showed that if you take populations that eat more meat protein, populations that eat more plant protein, the all-cause mortality with meat protein is higher. The all-cause mortality with plant proteins is lower. You look at that, doesn't seem like a lot, but it's showing you the direction that those foods take you in terms of health or disease.
Is that not also true when you compare animal fats to plant fats?
Yeah.
Yeah. So, there are many vegetarians who have what could be characterized as a high-fat diet. And while that's unhealthy, I think you can still say
plant fats are healthier than animal fats.
So,
while you don't have saturated fat as much in plant fats, and you don't have cholesterol, which are both not good for you, even though there's a popular press out there saying, fat's good for you. Right. Saturated fat's good for your heart. It's not good for your heart.
Yeah, it's ridiculous. So anyway, I'm going to close it here. With Dr. Howard's permission, we're gonna pursue some of these topics in a more succinct manner. We're going to have a variety of brief shorts on specific topics. But I did want to do a longer interview and kind of get his whole transition from a traditional diet into a plant-based diet. So it's great to have Dr. Howard here in Virginia, to have a plant-based doctor providing services in Central Virginia near Charlottesville. If you're interested, you can contact him.
RenovareLifestyle.com.
Renovare
You
Lifestyle.
can find a website and some contact information. So.
Yeah.
Renovare, Renovare. It's a Latin word. It means restore, renew. So Renovare Lifestyle Consulting. So.
Yeah. I like it.
Thank you, Paul.
Thank you, Dr. Howard. Much
Take
appreciated.
care.
All right. Thank you. Thanks for watching.